I'm responsible for babies in intensive care, which in the case of this place is predominantly the prematurity and the complications of prematurity, but we also deal with babies with surgical complications, babies with congenital anomalies of varying kinds. And I'm trained primarily in looking after babies, but of course that's the issues around looking after babies sort of cross the birth barrier, as it were. So I'm involved in counselling parents around what the specific diagnosis is, a bit around how it might have occurred, although the geneticists usually know rather more about that than I do, and then talking around what this means for the baby in life, you know, as in whether the baby has any chance of survival, what the prospects and conditions and quality of life might be should the baby survive, and what the burden of care for the baby is going to be. The way it commonly occurs is that, you know, you rock up to your obstetrician or to your scanning at 20 weeks or 24 weeks or whatever. The scan starts, the sonographer goes a bit quiet, turns the screen subtly away, looks worried and scans a particular portion of your abdomen 2 or 3 times, then says, I have to get the expert. Somebody else comes in and they mutter wisely over your abdomen while the cogs are turning furiously in your head. And then the cascade of referrals and consultation starts. And so, you not uncommonly are then in the position of having to make some very hard decisions about what to do with the pregnancy, whether to continue the pregnancy or not, and on what, should you decide to continue the pregnancy, what are your priorities going to be for the care of your baby before birth, during birth and after birth. And so an important part of my role is to hold a space in which those decisions can be played out. The optimum model is to have the paediatrician involved early in the pregnancy so that you can get the best possible picture for the parents to in order to make their decision. And then similarly, as you're coming up to delivery, there's the issue around, if you've got a baby who's got a very bad prognosis, what are the obstetric priorities in terms of how will the mother be managed, in terms of what compromises to mother's care, you know, are justified in the interests of the baby and what might not be. Similarly, if the baby's going to be born in poor condition and is going to require invasive, aggressive resuscitation in order to survive, what would the family's goals be around that? And that the process is a joint exploration of the facts, and sometimes a joint finding out of, well, okay, we don't know this, let's go off and find it together. And then there's the issue of helping parents to reach difficult decisions about the pregnancy, you know, whether to continue the pregnancy, whether not, whether to, how to, if they decide to continue, what are their real priorities for the baby. The times that I find hardest are probably where parents are focused on the nth degree of survival, and I've not managed to convey the burden of care fully. It's common for families to have, you know, a television view of what intensive care is like and what it's possible, without having a really balanced idea of the burden of care. You know, giving me the do everything instruction, exactly what they're giving me license to do. Now that's usually a way of saying, I'm very scared and I need more time, and there needs to be a lot more listening by me and a little bit more talking by me in order to sort of explore those issues more fully. And sometimes you'll find that there are things in the background which are driving that fear or driving that decision, which if explored more fully or in a different way, they might be factual issues, they might be theological issues, in which case the theological experts can sometimes find the key which unlocks it. And you've got to help the parents to find a way of making meaning of the experience in their own terms, which may not necessarily be my terms. Well, the first thing is that hope is really important, and that interestingly comes up in in a lot of the interview literature around parents who have had major antenatal diagnoses made, that it's critical to parents to maintain hope. Sometimes, though, it's a question of reframing what to hope for. You know, we all hope, as I said earlier, that that our baby will grow up and have a happy, successful life. You've then got to think about what goals are really important for you with your baby. And if the nth degree of survival is not either achievable or not realistically achievable, sometimes there's a need to refocus on what can be achieved for the baby, because, for example, you know, aggressive intensive care separates you from your baby, and it's common in my experience when talking to parents to find, you know, I always asked, what would you, if things are looking bad, what would be really important to you? What's the critical thing or critical experience you wouldn't like to have missed out on? And probably the commonest answer of all is, I want my baby to experience my love directly, and I want to have some experience of my babies relating to me. And of course, all of the things we do in intensive care can get in the way of that. Now, if that's going to make a defining difference to the long-term quality of the baby's life, that's a price that's worth paying. But if it's not, well, then you sometimes have to reframe what to hope for and redirect treatment, whether it's around resuscitation or whether it's around you know, medium to long-term treatment. You know, be true to yourselves and have an inner dialogue in which you define what's really important to you, and then explore that openly with the medical staff caring for you. There's a need for parents to be empowered and to have the sort of insight and introspection to really know what it's important to them. There's a need for better supports and for medical staff and other clinical staff in dealing with these issues. And there's a need for an understanding of the sort of the fallibility of both sides. Then also helping with the psychology of resolving what the goals for the parents are, bearing in mind that there are commonly two parents who may have very different goals.